Dr. Hussain, is it important to have hearing tested in children, and why? In what cases?
I believe it is, actually. So children, as you may be aware, are all routinely tested when they're born within a few days to make sure that there is normal development of the cochlea. Now, of course, they may be normal when they're born, but they can acquire a silent problem with their hearing development, such as glue ear. And usually it's a teacher or a parental concern that brings them into the clinic. And it's very important for them to have that because, of course, it impacts on their articulation and their speech and language and educational development.
So first signs, for instance, for a parent to question whether there might be a problem, what should they look for?
So usually it's if it's their first child, they will say, why is the television so much more louder? Or why is the child not turning the head when I call them? Or they're only turning the head to one side, which is the better ear. Now, the other thing to look for is most parents are quite educated when they have one or two children or friends and family, and they'll see that articulation is not correct. So if you have glue ear, which is commonly a low frequency hearing loss, the vowels are impaired. If you have a high frequency hearing loss, the consonants are impaired. So you'll be able to tell from a child, and most teachers are trained to pick up if the articulation of the speech words or the phonics are not clear and concise.
Mm-hmm. And from what age would you start picking up those subtle signs?
So, I mean, some children are very bright and can be speaking well from as early as 11 months onwards, you know, yeah. Routinely is when they start nursery, and it's around that age 3 when everybody's assessing their milestones for normal speech and language. And that's when I can occasionally get children who have suspected behavioural problems. And of course, when they do the routine hearing checks, of course, they didn't hear clearly to communicate what they wanted to hear. And so they have an expression of behavioural problems. So usually having a routine hearing test when they're young is very important for normal milestone development.
And is it difficult to test small children for hearing?
Well, everybody's difficult, but a child, when they have their own agenda, can be worse. However, when you make the test age appropriate and fun, it's quite easy. But it's important to do a simple pressure test for the middle ear, as well as play orientated hearing test for the child to get the thresholds that we need.
And then if hearing loss is actually diagnosed, what happens next?
So when hearing loss is diagnosed, we will recommend that they see their ENT specialist to help with further medical treatment for that, usually glue ear or anything else that may present.
Right. So intervention quite early is an important
Oh yes,
step.
Definitely. The earlier the intervention, the better the outcome for the child, as every day is a learning curve for them, because at that young stage, the sum total of their experience and exposure is their guiding hand for development for the future.
Absolutely. Wise words. Thank you very much, Dr. Hussain.
Thank you.